24% of college students reported seriously contemplating suicide, not at some point in their entire life, but at some point during the month of June 2020. 1 in 4 college-age students was considering suicide. This is an absolute disaster caused not by COVID, but by our policy response to COVID. We know that college students are at incredibly low risk of bad outcomes from COVID. College students are not going to die of COVID. College students are not going to become severely ill or hospitalized from COVID. That's an epidemiological fact that we've known from the beginning of the pandemic. The age gradient is the most important epidemiological fact about COVID, that it disproportionately harms people over the age of 70, people under the age of 50 are going to be fine unless they have very severe co-occurring medical conditions. So this is not a population that needed to be vaccinated against COVID. This is not a population that needed to stay at home or stay locked up in their dorm rooms. And in fact, this was a population, college-age students and young professionals, young adults, they were a population that were disproportionately harmed by virtually all of our COVID pandemic policies, from school closures to lockdowns to stay-at-home orders to vaccine mandates. The lockdowns, for example, created a mental health crisis among college-age students. So I wrote an article back in 2020 after several months of the prolonged lockdowns called The Other Pandemic. And the other pandemic was the lockdown mental health crisis caused not by COVID, but by our policy response to COVID. So in the summer of 2020, rates of anxiety disorders quadrupled, rates of depressive disorders tripled. 1 in 10 Americans reported severe suicidal ideation sometime during the month of June. And if you break that number down by age, 24% of college students reported seriously contemplating suicide, not at some point in their entire life, but at some point during the month of June 2020. 1 in 4 college-age students was considering suicide. This is an absolute disaster for young people. It should have been a canary in the coal mine that lockdowns and school closures need to stop immediately. We ignored it, and now, 2 years later, we're getting articles in the Washington Post saying what I was trying to explain to people 2 years ago, that this is a serious mental health crisis, that it's disproportionately affecting young people. That's not to say anything about the loss of education, the socialization, the developmental harms, even on young adults, not just on children, that happen during school closures and lockdowns. So this is an entire generation of people that have been scarred, I would say, is not too strong a word, that bore the brunt of bad policies which neither achieve their public health purpose, nor were free of massive collateral damage. And this, to me, is a tragedy. I think all college-age students owe an apology from their university and university administrators, first of all, and then from federal officials and state officials who pushed these massively harmful policies on young people.